Around. All right, so Mark, tell everybody your name.
Mark Moore,
Now, which shoulder was our bad shoulder?
right.
Right shoulder. And you kind of had problems for years with this.
Yes.
How'd you initially tear it up? I mean, what caused?
Four-wheeler accident.
Okay, so four-wheeler years ago.
Mhm.
I remember you saying it was popping, it was making noise, it was hurting. I mean, it was just
Limited to the things I could do.
certain ranges was
Positions, yes.
hard. Okay, now we put your Regen shot in how long ago?
1st of November, I believe.
November, so December, January, February, March, April. We're right at our month, 6 month checkup. Okay, so how's it done? I mean, what's pain levels been over the last month?
Of course, it's a little stiff in the morning,
Okay.
getting up, but as the day goes on, like, I feel nothing now.
It's feeling really close to normal.
Oh, yeah.
Range of motion and movement.
I'm good.
You can do anything you want to do.
Pretty much. Certain things, like picking heavy things up, I can feel it, but it's not like it stops me. I just feel it.
If you tried to do that before, how
I would
could
stop.
you do it, or did the pain say no?
The pain would tell me to stop.
Okay, so you definitely got more strength, more use.
Absolutely.
What about like throwing a ball?
I haven't tried. I get out there and I mess with the grandkids every now and then, but it's one of them things where I know it's there. I don't want to push the envelope, you know.
Okay.
So
All right, so you haven't really tried that, but
Right.
but maybe you could. You don't know.
as far as picking the grandkids up and everything, like when I'd pick them up before, I would feel it, and now I can just grab them and pick them up. So
So it's
my
definitely-
everyday life.
It may not
working
be
and everything,
100% improved, but it's a high 90s.
It's good. Yeah.
So you would recommend this to other people?
Oh, 100%.
Yeah, it's something that, in spite of a lot of people go through steroids, a lot of people go through surgery, and don't even get as good as this after all that. Whereas this is basically one shot done. You didn't have to do
Yeah.
any rehab.
None. And the research on the surgery and everything, the time to heal and therapy and all that, it wasn't worth it to me.
Yeah.
This was, like you said, the shot, and I was good to go.
Well, I like this because if it works, it's good, and you don't have to do all the other stuff. And at worst case scenario, if this didn't really help, you could still have surgery. But if somebody, like I've had people that's had surgery, and once, especially if they do like a replacement parts, plastic or metal replacement parts, well then if that doesn't really do good, you can't go back to this. So it's kind of a one-way thing. If you got a problem, you want to try this first. It's much cheaper than going through surgery, much easier. Don't have to do rehab, don't have the 6 weeks of downtime, none of that. You was literally back working like the
2
day,
days.
The day, yeah, 2 days after we did that.
I took 2 days off just because, and I was back to work. I was a little bit limited, certain things, but as time went on, it was like I could do, the progress was just, it was rapid.
Yeah, I like it, and you're obviously happy.
Oh, I'm very happy.
Now, we don't know if this is going to last a lifetime. We don't know how long this is going to go, but still, if this is decently long, years, even if you had to do this again, it would be worth it to do it again.
Yeah.
Versus try and go through surgery.
That was actually going to be one of my questions. What would happen if I had it injected in the same shoulder again?
It would just try and heal it more. It just, every time, I mean, your body naturally tries to do this,
Right.
and this just gives it a kick start. So anything that needs healing, this just kick starts it into healing more and faster. So anything that's hurt or tore up, this just kick starts it into healing more and faster. So down the road, let's say down the road, you start to have little problems with it. To do a booster shot on this is not a problem.
Yeah.
And you probably wouldn't have to have as much the second go around, so it'd be
Right.
a little easier, cheaper on that aspect. But yeah, a little booster can be done. You could do this every day if somebody had the money and just
Right.
want to do it every day, you can do it every day, but nobody's going to need that. But yeah, you can do a booster on this down the road if it needs it.
Well, I'm 100% satisfied on, and I recommend this to whoever.
Well, that's the whole thing. He's happy, we're happy. We're really making headroads with this. The state of Arkansas has been doing this since 2017, and now we're bringing this into the general public and maybe keeping some people from having, steroids, which are not really good for your bones and tendons and diabetes. The steroids are just bad. Replacement parts, some people do pretty well with them, but other people have had issues where they've had infections, amputations, even strokes or death is kind of a risk factor with any kind of surgeries. We don't have any of those risk factors with this. It's one shot, one simple shot, no risk of death or stroke from this. there's a minimal chance of infection, but like any shot, we keep everything, clean and we do everything right, and the risk of infection is really minimal. So I think we're pretty good to go.
I've had no complications at all.
Do you know what your prognosis was? What was the injury? Was it a torn rotator cuff? Was
Well,
it?
here's the thing on Mark. Mark didn't have the time or the money to spend on an MRI, so we really.
No, I got the MRI.
Oh, did you get one?
Yeah.
I thought at one point we said we weren't going to get one,
No.
but you did.
We got the MRI. Yeah.
Okay, so what was our actual damage?
There was 2 total tears in it.
Two tears.
2 full tears. In the
It was pretty bad. If I bent over and picked something up, I could feel something pop, and then I would have to use my left hand to put it back in place.
It was almost like probably starting to dislocate because of the ligament
Right.
laxity and tearing. But now, good.
No, I'm good to go. I have no problems at all. It's really good.
This is like this close to almost saying miraculous.
Right.
I mean, it's kind of crazy at how good some of these injuries can get and how fast. I mean, in the first week you were saying it's better.
Yeah.
And
I felt I felt it immediately.
And it just got better as it went.
And I actually asked you, does it just keep getting better and better?
And it does. There is, it heals for time. It's that kicks it off to where it heals. We've seen people that got better over like 6 months. Now, probably at about 6 months, however good it is however good it's going to be.
Right.
But a lot of the healing takes place pretty quick. But even it goes months that it keeps trying to heal.
If it stays like it, I mean, I'm perfectly fine the way
Yeah.
it is. It
We
doesn't
probably-
stop me from doing anything.
We probably at least got you back to your age now. Now, when you turn 80, you might have some issues, but we at least got you back, because before you were like 20 years older than your age with that shoulder.
I need to get another one, and
wasn't
maybe that'll drop me about 20.
Yeah, they're working on stuff like that, So, anyways, this came out really good. Mark's really good. He's now at his 6-month mark, so we don't have to check on him anymore. But obviously, if you have a problem with it, come back and talk to us.
Absolutely.
But right now,
Yeah, I'm good.
we're good.
I recommend this to whoever.
There you go. Thank you.
Thank you.